I'd like to thank y'all for joining us today on the update of COVID-19 status in Indian River County. To date, we have 68 people in Indian River County that have tested positive for this virus, and the vast majority of those are isolating at home. This is the total since the beginning of the event, and not the total that we're actually tracking at this very moment. There have been 18 total hospitalizations through the course of this event, and I think our current population of the hospital is 10. The supply chain for protective equipment for the hospitals and long-term care facilities and adult living facilities continues to be delivered. We're passing out personal protective equipment to the staff and the clients at these facilities. There continues to be daily discussions with all local municipalities, law enforcement, fire rescue agencies to address countywide needs and consolidated actions for the health and safety of our citizens. Again, I'd like to thank all of our municipal partners for their input and cooperation during this time. It's been truly a team effort countywide. There are no apparent issues with the supply chain for food or fuel, so that's not an issue in the county. We would like to remind our residents that if they need information regarding masks or essential personnel, to please contact our information line at 772-226-4000. And please do not dial 911 to get this information. Use the information line. We don't want to overload our 911 system. Get my fingers to work. There are a number of agencies in the county that are assisting to meet the unseen needs of the community, and a list of those supporting agencies can be found on the county's website, which is www.ircgov.com. Those include the Salvation Army, the Source, American Red Cross, United Way. They're all helping to meet the needs of the citizens. On behalf of the Indian River County Board of County Commissioners, the Department of Emergency Services, and the County Administrator's Office, we're saddened to announce the first death in Indian River County related to COVID-19. Our heartfelt sympathy and support go out to the family during this incredibly difficult time. This was an 88-year-old female that had no travel history prior to the incident. At this time, I'd like to turn it over to Miranda Hawker from the Health Department from Indian River County.
I'd like to be able to give an update on our statewide numbers. So statewide, as of 11 a.m. today, we had 17,531 cases with 2,360 hospitalized and 390 deaths. Our current number of cases in the county is 68. 30 of these are travel related, 35 are not travel related, 3 are unknown and under investigation. We have 18 people, as Chief Stone had mentioned, that have ever been hospitalized. Some of those include currently hospitalized. Some of those have been released from the hospital. The age range of our cases is from 8 to 94, with 39 men and 29 women. We, as Chief Stone had mentioned, had one death in that 88-year-old female with no travel history, and our sympathies go out to her family. All of our cases are self-isolating at home or isolated in the hospital. And I know I say this each time, but I want to urge all Indian River County residents to stay home and only go out for essential trips. I know many of our residents have celebrated Passover and may be celebrating Easter on Sunday. These celebrations will look a little bit different this year. It's important that people stay with our social distancing recommendations and keep their gatherings to less than 10 people. We stress for people to stay home as much as possible. This will help keep you and your family safe. I again want to reiterate those steps to help prevent COVID-19. Practice social distancing. Maintain that 6-foot perimeter around you in any public area. Wash your hands often for at least 20 seconds or use a hand sanitizer with 60% alcohol. Avoid touching your eyes, nose, and mouth. Once your hands are contaminated, they'll transfer the virus to your eyes, nose, and mouth. And that also goes for people who are wearing gloves. Once those gloves are contaminated and then you touch your eyes, nose, or mouth, you've transferred that bacteria or transferred that virus. I do want to touch on a recent MMWR publication from the CDC. That's the Morbidity and Mortality Weekly Report. That Morbidity and Mortality Weekly Report looked at coronavirus disease in children for 2019 in the United States between February and April 2nd. So while children with COVID-19 infection have mild disease and do not always report fever or cough, COVID-19 illness resulting in hospitalization, admission to intensive care, or death does occur among children. While some children may have that mild illness and not show symptoms, they can still spread that disease to others. It's important for people of all ages to follow the recommendations from the CDC and state and public health authorities to help prevent the spread of COVID-19. I do want to address the CDC guidance that came out this week on April 3rd, recommending the use of cloth face coverings in community settings to help reduce the spread of COVID-19. So there's more evidence that is growing that people who are infected can spread the virus before they show symptoms and in the absence of symptoms. So we call that people who are pre-symptomatic or asymptomatic, and they are still able to spread the virus, although people are most infectious when they are most symptomatic. Wearing cloth face covering may help prevent the spread of the virus by people who are infected and do not know it. The CDC recommends wearing cloth face coverings in public settings where other social distancing recommendations are difficult, like grocery stores and pharmacies, and especially in areas of significant community transmission. It's important that even though you're wearing a cloth face covering, that you take those steps to maintain your social distancing. So just because you have a cloth face covering does not mean you can get around people closer than 6 feet. You need to still maintain those good practices that we've all learned over the last few weeks. The cloth face coverings recommended are not surgical masks or N95 respirators. Those are critical supplies that need to be reserved for healthcare workers and medical first responders, as recommended by CDC guidance. I do want to remind everyone, I'm sure you've already heard about this before, the new survey from the Department of Health called Stronger Than C19. It's a brief survey that's available online at strongerthanc19.com that will help give us a better idea of what people's practices are across our state, their awareness levels of COVID, and also their practices that they're doing at home. And by knowing that, it strengthens our ability to help prevent COVID-19. I do want to, the last thing, the Department of Health in Indian River, I announced this last week, has signed up for the Nextdoor app. We're sending updates out through that forum as well as in these press conferences. And at this point, I'd like to turn things over to, I have one more thing. The testing, in terms of our total testing numbers, and this is what's reported has reported in our electronic lab reporting system. So those are the reports that come directly to the Department of Health. So for our county, 876 in total have been tested for all reports we have received. 8% of those reports are positive. So 68 positive, 808 negative. We have 31 tests that are pending in that system. That is not an all-inclusive list of all of the tests. That's what's been reported to us at this point. And at this point, I'd like to turn things over to Corey Richter. Thanks.
Thank you, Miranda. Just going to report a little bit on the hospitals. They're both Sebastian River Medical Center and Cleveland Clinic, Indian River Hospital. They're severely limiting the visitors into their facilities. So if you have to go there and visit, please check their website and make sure what the current policies are and times, because they're trying to reduce the possibility of cross-contamination with current patients that are in there that don't have COVID-19. Indian River's website is indianrivermedicalcenter.com, and Sebastian River is sebastianrivermedical.org. So check their website for if you have to go visit anybody in those facilities. Otherwise, I can assure you that both hospitals have been planning for this COVID-19 virus. They are well prepared for the virus and to treat patients infected with the virus. They're planning ways to keep them separated from any of the other patients that are in the hospital, and they're both planning for a potential surge if we go above their capacity in the hospitals. And they've been planning for weeks on that. They meet daily and plan for the worst. We're hoping for the best, but they're planning for the worst, and they are prepared to help the citizens of Indian River County if need be. Couple numbers here. For Cleveland Clinic, the hotline for their COVID-19 hotline, they've taken to date 3,642 phone calls. And of that, they've done 800, let me get my glass, so sorry, 847 tests that they've done. 658 have been negative. 141 are still pending, and they have 48 total positives to date. Sebastian River Medical Center, their numbers, they've tested 52 people, 43 have been negative, 5 are pending, and they have 4 positive cases up there. So they're testing Indian River obviously is testing a lot more because they have the drive-through, and that's been very successful in getting people who need to be tested through the process and tested, been helping. Now Sebastian, I think I talked about it last time, they're doing 100% mask on everybody. That's all their staff and all visitors. They do recommend that as a visitor that you bring your own mask because they don't want to try to not use their supply. But they are putting a mask on everybody, and they're requiring it on everybody that steps in the door of their facility. They're also temperature testing all their staff before shift, after shift, and during if anything changes. And if they get above 100 degrees, a temperature above 100, they send them home or they don't allow them in, whichever. So they're trying to do that all for your safety, for the public safety, and for the safety of the patients in the hospital. I don't have any more unless anybody has any questions for me.
I did have a question.
Yes, sir.
So what's the total number for Cleveland Clinic so far, including the hospital testing and the
What they've tested in the hospital for Cleveland?
Yes.
847.
Oh,
847 total tested.
total, okay.
Okay, with 48 positives out of that.
Okay.
Okay.
Any in the ICU?
Yes, there are, I believe it's 6 or 7, don't quote me on that, in the ICU as of yesterday. I didn't get the numbers today, but I believe that was what the numbers were yesterday.
And that would be Indian River?
That's
Cleveland.
Indian River Cleveland Clinic, yes. Yes. Sebastian has none in-house positive cases yet. All the cases that they've had were able to go home. They didn't need higher medical care. So they were able to quarantine at home, and they follow up on them. Okay. Any other questions? All right, I'm going to turn it over to County Administrator Jason Brown.
Thank you, Corey. Good morning. First, I would like to reiterate and share our deepest condolences with the family and the friends of our first Indian River County case that passed away. Earlier this week, we had heard some positive news about COVID-19. The nationwide projections had decreased from potentially over 100,000 to 80,000 to 60,000. This is good news. However, I want to remind everyone that these projections are dynamic. Unlike the weather forecast, which we don't have any control over, each Indian River County resident and each resident of Florida in the United States and the world has the possibility to change these forecasts. So by social distancing and practicing social distancing, we can lower those numbers and have a better outcome. If we do not do those, then the numbers can get worse. So I want to say that what we've been doing is working. So I would encourage everyone to continue doing what you're doing, because when what you're doing is working, you need to keep doing that. So just want to reiterate that message. And this concept was captured about a week and a half ago. In the words of President Trump on March 31st, I will read them here. Each of us has the power through our own choices and actions to save American lives and rescue the most vulnerable among us. So I think those are very important words. I want to reiterate those, that we have control over the impact of COVID-19 in our community, in our state, and in our country. And I would say that today's unfortunate news is a poignant reminder that we need to not let our guard down, and we need to remain vigilant in this fight against COVID-19. With that, I want to wish everyone a happy and safe Easter and Passover celebration. Please remember to practice social distancing and stay well. Thank you. And we can answer any questions that you may have.
Any questions for us?
Hey, the person who died, when was that person tested positive? When was that?
I don't have that background information. I don't believe we have that.
Do you have any information about whether she had been hospitalized or whether she was isolating at home?
She was hospitalized.
Do you know how long she had been hospitalized?
No, I do not. And certainly under HIPAA guidelines, I don't know that I can release any more information than I already have, so. Okay. All right, anything else? Got anything?
I did have a question. So the 68 people, that's a cumulative number? It's not the
Cumulative number.
number of people that you're tracking?
That's correct. It's a cumulative number, and also the number of hospitalizations is a cumulative number. All right, anything else for us? We'd like to thank you all for spending some time with us, and we appreciate your attention. Thank you very much.